Hello everyone. On behalf of the Sullivan County Legislature, we welcome you to another streaming event from the EOC. Rob Doherty, our chairman, has decided to get together some familiar faces, starting with Josh Potosek, Nancy McGraw, and we've asked fellow legislator Nigel Reich to join us as well. It was suggested we try our best to keep social distancing, and sometimes it was pointed out that it doesn't look like we are keeping the proper distance. So today, actually, Dan was nice enough to mark on the floor the distance, so we are standing at our place, and the camera will be moving instead of the speakers moving. So, first question today. This will go to Nancy. How many cases are confirmed to date, and how many people have recovered? How many people have died, and can you provide any details?
Good afternoon. So we have our dashboard behind us, and we continue to update this every couple of days for the public when we do these town hall meetings, and it is on our website. We have 188 confirmed cases, and we're continuing to see an increase of anywhere from 10 to 20 positive lab results every day in the past 4 to 5 days. So we did anticipate this, and those numbers will continue to climb. We hope that people will listen to the stay-home messages and the isolation messages. The good news is that 48 of those 188 have recovered, and they're no longer on isolation, which means that they're not sick. So we're seeing about a third or more of people who test positive so far with the data that we have of people who are able to fully recover at home. We do have 14 patients who are in the hospital currently, and unfortunately 5 who have passed away. Those 5 individuals range in age from their 50s to their 80s. The majority of them are men, and 1 female passed away recently. So this is an equal opportunity virus, and we want to protect our most vulnerable residents, and we'll be talking more about that with our social distancing message.
Thank you, Nancy. I have 2 questions I'm going to group together. They're for Josh. They're a little long, so bear with me. Who makes the decision on what information to reveal to the general public concerning concentrations of the COVID-19 outbreaks in Sullivan County? What is their background to make this decision? Does the withholding of information cause an even more widespread panic with everyone thinking it is in their neighborhood? Second piece of this question. Thank you for posting statistics on the dashboard. Can you more clearly articulate the reasons why you have decided not to add a town-by-town breakdown of case numbers to a Sullivan County dashboard map? What are the pros and cons of making this information public?
So it's really been a collaborative decision-making process, and there's been a lot of debate on the pros and cons of releasing town-by-town information. So we have anyone from Nancy and public health experts to EMT, public safety, law enforcement. It's really looking at the public health and public safety need to release this information. Obviously, there's a lot of counties in the Hudson Valley that have chosen to release this, and some are second-guessing releasing the information. And when you look upstate, there's very few counties that are releasing town-by-town information. So it's been a real collaborative approach, and the legislature has even weighed in and looking at the pros and cons on where they see the usefulness or not of these maps. So the maps themselves on a town-by-town basis, in one county upstate last night was talking about how it really opened people's eyes to that this is everywhere. But when you look at the cons on why to release this, it really gives us false sense on both sides. You could see a large number of cases in one town or no cases in one town. Doesn't mean the virus isn't in that town with no cases, because the cases are being reported by the residents. Doesn't speak to where the person came into contact with and was exposed to the virus. So it really leads to a real false sense because it's reported by household versus exposure site. And we don't want to create panic or hysteria that there are a lot of cases in one particular town versus not, and create a public safety issue. So we've really taken the approach, and and the data itself we feel isn't useful in the sense that I think the residents should just assume it's everywhere. Practice and follow the state and federal guidelines of staying at home as much as possible. Only travel for essential business, to go to the grocery store or your primary care provider or hospital. So if you do that and wash your hands and follow those guidelines, that's the safest thing you can do. And any data on a map isn't gonna help you one way or another to follow those guidelines. So I think following the guidelines is the most important thing. Data on a map will not help you stay safe from this virus.
Thank you, Josh. Just let me accentuate that answer again. It's very important. The numbers, if it was published currently, where they live, it's simply just that, where they live, not where they got the exposure. It's so important to keep in mind. Next question. Are healthcare workers and first responders being tested? Nancy?
The testing protocols set out by the State Health Department and the Centers for Disease Control are the same. It is the physicians that approve the tests based on an individual's clinical condition, their risk factors, and whether or not they have symptoms of fever, cough, shortness of breath, and like. They also make that judgment based on an individual's medical history and exposure. So that is a physician-led response in terms of decision making. They do consult from time to time with public health and with state health department officials for prioritizing testing, because continues to be limited in its availability, and we'll talk about that a little bit more later. But testing protocols are being implemented and followed in the same manner by all of our healthcare providers to the extent and knowledge that I'm aware of.
Thank you, Nancy. Next, I'm going to combine a couple questions, and Naja Reich is going to answer these. First one, when will antibody testing be available for those who are asymptomatic? Second part of that, the President mentioned the new 5-minute COVID-19 testing systems were being distributed to more remote areas. What is the availability of testing for county residents as of today?
Hello. Before I answer those questions, I do want to extend a huge thank you to the emergency management team, starting with Josh, Nancy, Rick, and anybody else, the sheriffs, anybody else who's been involved in getting this information out to us and working on this crisis. Second, April 19th is the start of Lab Professionals Week, and May 6th is the start of Nurses Week. So I'd like to send out a big shout out to these two huge professional groups into everything that they're doing. We know that laboratory work is important, and certainly whatever the nurses are doing is extremely important. So be careful, and thank you for all you do. To answer the first question, do we have antibody testing available now? Not in this area yet. There are many laboratory industries that are working on research and development into producing such testing. The test that the President had, I'm not really sure which one it was, for the antigen or the antibody. I have no idea, but I will try to get that answer. And what is the availability of testing for county residents as of today? The same as anywhere else. I do want to clarify a couple of things that you might see on TV, these huge areas where they do testing. I want to clarify that is not a testing area. It is a sample collection area. So there's different types of samples that people are collecting, and we are running out of those resources as well. Those are swabs, where they're swabbing the nasal area and the mouth, the oral area. Those swabs are now being sent to testing labs, and not every lab has the capability of testing for this particular virus. So LabCorp, Quest, Crystal Run is getting that availability now, and I'm not putting a plug in for them, but I'm just letting you know of the areas that I'm aware of. So there is a backlog now of testing. Again, there's the testing site or the collection site, and then the testing site. There's two different types of tests that we're talking about. The one that is being currently done is looking for the antigen or the virus. So the delay in the process is when they collect the sample on the swab, they need to extract it using certain chemicals. They need to then isolate that part of the virus. They need to replicate that genetic material, and then they test for it. So normally it would take maybe 2 to 3, possibly 4 days, but because of the backlog and the number of collections that they're doing, it takes a very long time for the turnaround. On the other hand, the antibody testing would be wonderful, but we're not there yet. The antibody testing is a blood test that will test to see if somebody has had the virus, the disease, and has since then become better. And the antibodies that have developed in these people can then be tested. So we're not there yet. I'm hoping that we will get there soon, but there's a lot of lab companies that are researching and developing this, and we're just awaiting the test kits. Thank you.
Thank you, Naja. Next question is for Nancy. Is CRMC able to get more ventilators when they need them? And is this being coordinated with the state?
Our incident command team is on regular conference calls with the hospital, and they're updating us on their status of supplies, PPE, and including ventilators frequently. So we've been talking to the state on a regular basis about our resource concerns through multiple channels every day. This includes the State Health Department, the Department of Homeland Security, and the Office of Emergency Management, also directly with the governor's staff and their representatives.
Thank you, Nancy. Next question I have is also for Nancy. What is the local government doing to ensure the citizens of Sullivan County who may become infected with COVID-19 and will be able to receive hydroxychloroquine and azithromycin? What is the supply status of these drugs, or is there a shortage?
So we've heard information that there may be some concerns about shortages statewide of these drugs, and locally not really a problem currently, but we're keeping a close eye on it with the hospital to see if they have any concerns about a shortage. I want to reinforce that these drugs are not FDA approved in terms of a treatment, but given the current crisis and pandemic statewide and nationally, physicians are having to be creative, and there's research that's ongoing to help save lives. And so sometimes in a situation like this, it becomes necessary to use treatments that are not normally utilized. And again, this is a novel virus and something that humans have not been previously exposed to. So we're in unfamiliar territory here, and our medical professionals are doing the best they can.
Thank you, Nancy. Next question goes to Josh. Ulster County just announced that they will not be issuing seasonal permits for summer camps, saying that they can't ensure the health and safety in the camps. It's a rule that they are using to bypass the state. Are you going to do that? What else is the county planning to do to protect residents from potential vectors of infection from people coming here from other areas?
Yeah, so just more populous counties in the state generally have full service, what we call full service health departments, which means they issue their own permits for anything from camps to restaurants to pools. Sullivan, like most rural upstate counties, does not have a full service health department, which means we rely on the State Department of Health to issue those types of permits. We've had numerous conversations with state DOH, local governments, local PDs, code enforcement about this very issue. Normally, in a normal year, state DOH doesn't issue permits for camps till normally the end of April, so on their normal time frame, they wouldn't have issued permits anyway. We expect, but don't have firm confirmation, that they are going to at least delay issuing permits. Just due to the density issue, it becomes difficult to operate a camp if you're trying to keep everyone 6 feet apart. So if they don't, we're looking at other options locally to see if there's executive orders that we can issue to do that locally. Obviously, that would need approval from the state. So we are actively looking at this, and obviously it's a concern from county government to town governments, local PDs, and our public health department.
Thank you, Josh. Next question. Is there any kind of travel ban in place? I'm going to answer this real simply, no. Everyone at this time should be in some variation of self-quarantine. That's been the directive for since this crisis began. It's a simple, easiest thing that one can do. Minimize your trips to the store, wash your hands, you've heard it all before. It's up to you. Mentioned before, we have a free country. People are moving about, but it's so important to keep that movement to a minimum to put a wall up, if you will, against this virus and prohibit it from spreading the best we can. So with that, I'll move on to the next question, which will be for Nancy. Are essential businesses being monitored by the Board of Health or New York State Department of Labor to ensure proper safety guidelines are followed? And are employees of these essential companies being given protective gear?
So essential businesses are monitored by a variety of different state oversight departments, depending on the type of essential business that it is, whether it serves food or is a store or a restaurant doing takeout or a government, municipal government, depending on the type of business. So private businesses have been provided with guidance and will continue to do that. For keeping employees and the public safe as possible with cleaning and disinfection guidance and social distancing guidance. We have received some phone calls regarding concerns from citizens about the social distancing not being reinforced in certain businesses and stores, and we're working as closely as we can with those private businesses to ensure that everybody stays safe and that it's manageable and that people are listening to those messages.
Thank you, Nancy. Our next question is for Josh, and it is a long one. According to the World Health Organization, aerosolized COVID-19 can hang in the air for an hour or more. According to Atlantic Magazine, grocery stores are at the center of contagion because it's impossible to maintain the critical 6-foot separation. Beyond that is the danger of walking through aerosol. Please forgive me. Aerosolized. Thank you very much. Mists. What is the county doing to mandate that grocery stores, like restaurants and bars, evolve to a takeout model immediately?
Similar to other regulations, the New York State, through executive order, has regulated these various businesses, including grocery stores. So locals have no real authority to mandate them to do anything. Obviously, we're fielding questions and calls, and we've seen some best practices on social distancing and some grocery stores utilizing certain hours where our senior population can shop. So there's various best practices that we've seen that we're going to be distributing to our various grocery stores in the county. Obviously, we're fielding calls if people have concerns that there are issues, and we're addressing them with our local Department of Health operation in Monticello.
Okay, the last question we have for today is something that I will address, and it is, I cannot find any N95 masks, hand sanitizers, or gloves. Are the towns or county providing them? Where can I get them? I mean, simply stated, the county is not providing masks, hand sanitizer, or gloves to private citizens. Basically making sure that our first responders, healthcare providers have that. The initial shock of the COVID-19 outbreak led to quite a run on the inventory. The supply chain is improving, and we've seen an uptick in that inventory at the retail outlets. And with that, I'd like to thank Josh, Nancy, and
I would
Nigel.
just like to add one more thing. Is that possible?
Sure.
As Nancy had mentioned before, this is a novel virus. This is all new to us. No one has immunity. That's why it's running its course the way it is. So the best thing I could reiterate is please stay home. Like was said here multiple times, please wash your hands and keep your distance. Do not put your hands to your mouth or to your face. Please, please, please stay home and let these guys do their job in containing this virus. Thank you.
Thank you, Naja. And so I like to close with this, that obviously I'd like to thank everybody that sent in the questions. the Sullivan County Legislature thanks you immensely for the dialogue that we're having with you. And remember that there is no way humanly possible to have everything 100%. There isn't a 100% answer for this. So it's personal responsibility, and you've heard what to do multiple times. It's no different now. So please continue to make the right decisions, keep your hands clean, and be safe. Have a good afternoon. Have a good weekend. Bye for now.